It is important for us as epilepsy specialists to classify what type of epilepsy exists in each of our patients. It's important to classify the type of epilepsy because treatment really depends on proper classification. We utilize video EEG monitoring as our tool to help differentiate if a patient has a focal epilepsy or a generalized epilepsy. Focal epilepsy means that someone has an area of the brain or a focus or a part of the brain where that area of the brain has hyperexcitable networking. When seizures occur, they start in that particular focus of the brain, and they may just be centered in that focus of the brain. There is a possibility that that seizure activity that begins in one focus of the brain may spread to other brain regions or the whole brain itself, leading to what we call a secondarily generalized seizure. Amongst the focal epilepsies, they are divided into different sections. You can have the most common type of focal epilepsy called temporal lobe epilepsy, and that involves the temporal lobes of the brain, the right temporal lobe or the left temporal lobe. You can have frontal lobe epilepsies where seizures begin in the frontal lobe of the brain. You can have parietal lobe epilepsies where seizures begin in the parietal lobe of the brain, or occipital lobe epilepsies where seizures begin in the occipital lobe of the brain. Generalized epilepsy is a type of epilepsy where seizures begin in both sides of the brain all at once, the right hemisphere and left hemisphere. And when you look at a seizure in someone with a generalized epileptic condition, you can see that the seizures begin everywhere all at once. It is important for us to classify the type of epilepsy because treatment is very much dependent on what the classification is. For example, some medications that are indicated for the focal epilepsies may worsen seizures in people who have a classification of generalized epilepsy. And when it is not known the type of epilepsy that one has, it is very important for an epileptologist like myself or Dr. Klein to figure out what seizure types are occurring, what epilepsy classification there is, so that we can guide treatment appropriately.